World Diabetic Day 2025. This awareness campaign was started since 1991 by IDF, International Diabetic Federation, and World Health Organization to pass or to create awareness about this illness in the society, in the community. This is the main aim of the World Diabetes Day. Lulu, I appreciate them more because the same day they found and they took a chance to celebrate or to observe this day in these premises. Coming to the diabetes, I know this is not a health awareness session. We want more time to give an awareness about this illness. Present day, modern world, humanity, we people are very much affected, suffered, or anxious about this illness. Similarly, medical community or medical fraternity also equally worried about this illness. Why this happens? As we know, this is a chronic lifestyle illness. Lifestyle means, the definition of the lifestyle means, lifestyle changes means changes in our food habits, lack of exercise, over stressful situations, bad habits, like that it goes on. Again, I'm coming back to the diabetes. Present day statistics, when we check, world over, 589 million people suffer from diabetes, current present day, 589 million people. At the same time, another 250 million people living on this earth without knowing that they are having diabetes. They are diabetic people, they have all the complications of diabetes, but due to the lack of difficulty or lack of symptom, they don't know they are diabetic. Another 600 million people, they are called pre-diabetic situation. So for the understanding purpose, we can classify, we can divide normal people one side, they are not having any illness, normal people, their blood sugar will be below 100 when they check empty stomach, in empty stomach. Below 100 in empty stomach, fully normal. Above 126 in empty stomach, they are diabetic. In between 100 to 125, they are called pre-diabetic. So around 800 million people are under the risk of diabetes. Why diabetes is so important? I'm not going into the details because we have so many. When we discuss a disease, we have to go through the reason, the difficulties we face, how to find the disease, how to treat the disease, what are the complications, and what will happen if not treated. These are the few things when we approach an illness. Due to the our time constraint, I'm going to some of the points of the diabetes only. Diabetes is a silent killer, that we should know. About 50% of the people will not have any difficulty. We will have diabetes. As I told, 600 million people on this earth live with 600 million people with pre-diabetes they are living. In the coming 4 years, if they don't take necessary steps, serious steps, definitely they will fall into diabetes side. This is the situation. Anyway, two numbers you have to remember. Before, in empty stomach, 100, below 100 normal, above 126 normal. After food, below 140 normal, above 200, we are diabetic. This is the situation. Don't get confused. Why diabetes is so important? That is our question. If most of us think, I have diabetes. Diabetes once developed, there is no cure. Suppose we have a typhoid disease, we have a malaria disease, or we have a hernia, or we have some other thing, we can treat it, we can cure it, and he will be all right fully. But once we are diabetic, that means once we are above 126 of blood sugar, we can control the diabetes, but we are not free of the illness till death. This is the scientific situation. Till this time, scientists are not able to give a single solution to treat the illness like this. Suppose COVID, we had COVID, many people will die, some people will survive, but those who are survived fully free of illness. But diabetes, it's not like that. So, I'm coming back to the diabetes. So, diabetes is a situation, is a lifelong illness. And another thing, if we don't treat diabetes, what will happen? This is the most important thing. If we don't treat the diabetes, this is just like a super highway. Diabetes will take us to many, many complications very fast. Number one, that will take us to the heart attack, number one. When we compare a normal person with a diabetic person, there is 4 times chance for him to develop heart attack. About 80% of the diabetics die of either heart attack or stroke. This is the scientific fact. So we will be reaching heart attack very fast. Another thing, about 30% of the heart attacks which occur in diabetic people is called silent heart attack. When we develop a heart attack, we will get a chest pain, we will get chest oppression, we will get a chest burning, we will get a radiation of the pain to neck, we will get radiation of the pain to left upper hand, sweating, vomiting, fatigue, dizziness, fall. So many things will happen in a normal heart attack situation. When a diabetic develops a heart attack, about 30% of the heart attacks which occur in diabetic people will not have any symptom, any difficulty. He will develop a heart attack. If you are lucky, he will survive. Otherwise, he will die on the spot. This is another seriousness of the heart attack in diabetics. So we are coming to the complications. Number 1, heart attack. Number 2, the kidney diseases. When we compare a normal person with a diabetic person has got 17 times chance to develop kidney disease when compared to a normal person. This is the kidney disease. Number 3, eye disease, vision loss, and so many things. So when we compare a normal person with a person with diabetes, about a 25% chance to develop eye disease in diabetic patient. So heart will be affected, kidney will be affected, eyes will be affected, then stroke. You might have heard the stroke. A diabetic person has got 4 times chance to develop stroke when compared to a normal person. Along with, we will have so many leg problems. Diabetic ulcer in the foot, it is called diabetic foot. And most of the time infections will spread, uncontrolled infections will develop, and we have to remove the legs. We have to surgically remove the legs. When we go to the world literature, every 20 seconds, please remember this clearly, every 20 seconds, 1 leg is lost in this globe due to diabetes. Every 20 seconds, due to infections and other things. So diabetes is an important illness which causes the serious infections of the legs and other extremities. And along with patient, he will lose his resistance capacity. That means immunity will be lost, and every time he can develop many infections, chest infections, urinary tract infections, eye infections, and soft tissue infections, bone infections, brain infections, like that it goes, infections. And another thing, loss of sexual capacity, importance. About 50 to 60% of diabetics will develop sexual inability due to this illness. I'm not going to the mechanism of the illness. Why this develop? Why heart attack develops in diabetes? Why heart attack develops in, why stroke develops in heart attack, diabetic patients? Because these are all time-consuming process. So I'm not going into the exact mechanism why this happens. So these are the most important complications of diabetes. Along with many other small complications will develop. Nerve complications, that means we will not know the exact sensation of the legs, hands, and everywhere. And sometimes we may feel burning sensation of the foot in the night time, sometimes in the daytime, sometimes always. And sometimes when that develops, we may feel that our chappal is slipping from our legs, sometimes like that. So many feelings we may get. These are the complications of the nerves. Like that, almost all areas of the body will be affected by diabetes. So we have to consider diabetes a serious illness from today onwards. Here, I am not going to not give any details about the treatment of the illness and the reason why this develops. Till this time, scientists are not able to give the single one reason to develop this illness. They are telling so many risk factors. Anyway, I am sorry, due to time constraint, I am going to wind up. Anyway, we have to have 1 second I will take. We have to have some preventive steps. Number 1 is this exercise. Number 2 is our dietary habits. Number 3, our stress control. Number 4, avoid alcohol, avoid tobacco, and avoid sedentary life. And please have an active, energetic life from today onwards. And please, everybody should have a sugar checkup at the earliest, and please have a consultation with your physician or doctor. And I am extremely thankful to the authorities of this event for giving me a chance to interact with you. Thank you very much. Wish you good health.
Thank you to everybody for coming today. Really appreciated on World Diabetes Day, and stay fit, stay healthy.